Hello, I am Jianbing Ma, Executive Managing Editor of Arthroplasty. Rigorous preoperative planning is a cornerstone of successful total knee arthroplasty. Today, I'm presenting a study that addresses a critical question, especially relevant for teaching hospitals. Does surgical experience affect the accuracy of this vital planning step? Before a TKA, surgeons use digital 2D templating on X-rays to predict the correct implant sizes. In academic centers, this important task is often performed by orthopedic residents. This practice is essential for training, but it raises a fundamental question of quality and safety. Can a junior resident perform this task as accurately as an experienced, board-certified surgeon? This study by El-Khayali and colleagues set out to answer exactly that. The researchers retrospectively analyzed 424 primary TKA cases. Each preoperative plan was performed by one of three distinct groups: junior residents with less than 3 years of training, senior residents, or board-certified attending surgeons. The team then compared the templated implant size with the size that was actually used during surgery to measure the accuracy for each group. First, let's look at the overall accuracy. As you can see from the table, 2D templating proved to be a highly reliable tool. While an exact match is not always achieved, the accuracy within one size up or down was excellent. Over 92% for the femoral component and nearly 89% for the tibial component. This confirms that templating is a very useful clinical guide. But here is the most important finding of the study. When the researchers compared the accuracy across the three experience groups, junior residents, senior residents, and attending surgeons, they found no statistically significant difference. As Table 4 clearly shows, the p-values are high, indicating that the mean deviation was comparable across all groups. Early-stage residents performed just as well as their senior colleagues. In conclusion, this large-scale study confirms two important things. First, 2D digital templating is a highly accurate and reliable tool for preoperative planning in TKA. And second, this accuracy is not dependent on the planner's level of surgical training. These findings provide strong evidence supporting the common and essential practice of delegating templating to residents, validating it as a safe and effective component of both patient care and orthopedic education. So I invite you to read the full study for a detailed analysis of these reassuring findings. Thank you for watching.